Myths and misconceptions about addiction are misleading, dangerous, and far from true. Maybe you've heard some of them. They go something like this: "You're weak. Why can't you just stop using? Treatment never works. Once an addict, always an addict." Do these statements sound familiar? If you or someone you know has struggled with addiction, you may have heard some of these false ideas. As a substance abuse counselor, I've learned a lot from working with people fighting addiction. Addiction is a complex disease that has a powerful grip on both your mind and body. Believing these myths and misconceptions about addiction can greatly impact your recovery journey. Let's talk about them so you can believe in yourself and your ability to put addiction behind you and stop letting it control you. Myth number 1: addiction is a choice or a character flaw. It's a common misconception, but the reality is far more nuanced. Fact: addiction is a complex disease that extends beyond mere choices or moral character. Extensive research has shown that addiction involves changes in the brain. These changes affect the reward system, decision-making processes, and self-control. But what causes these brain changes? Well, there's a combination of factors at play. Genetics can predispose certain individuals to be more susceptible to addiction. Environmental factors such as exposure to drugs or a history of trauma can also increase the risk. Also, psychological factors play a significant role. Mental health conditions like anxiety or depression can coexist with addiction, creating a complex interplay between the two. It's important to understand that addiction is not a result of weak willpower or a lack of moral character. Think of it this way: would we blame someone with diabetes for having a pancreas that doesn't produce enough insulin? Of course not. So why wouldn't the same logic apply to someone with addiction? It's easy to blame the person with the addiction because understanding the complexities of addiction can be a far more arduous task. Myth number 2: only illegal drugs are addictive. What is the first image that comes to mind, or the first thing you think of when you hear the word addiction? It's probably heroin or cocaine. This is because most of us have watched TV shows like Narcos and Breaking Bad, or seen at least one documentary on the opioid epidemic at least once in our lives. In those shows, all we see are people overdosing on heroin or snorting cocaine. So it's no wonder these are the drugs that our brains associate with addiction. Fact: addiction can arise from a wide range of substances and even certain behaviors. So you might be surprised to learn that even legal medications like prescription drugs have the potential for addiction. Did you know that in 2019, the National Institute of Drug Abuse reported an estimated 9.7 million people in the United States misused prescription pain relievers, tranquilizers, stimulants, or sedative for non-medical purposes? When misused or taken beyond the prescribed limits, these medications can trigger addictive patterns in the brain. That's not all. Behaviors like gambling or gaming can also lead to addictive patterns. Up to this point, you might have thought that playing on your PlayStation to release stress after work is just a hobby, but it too has the potential to be addictive. Research has shown activities like gambling and gaming can stimulate your brain's reward system, creating a craving and compulsion to do them repeatedly. This behavioral addiction shares similar neurological mechanisms with substance addiction. In fact, the World Health Organization recognizes gaming disorder as a mental health condition. According to their estimates, around 3 to 4% of gamers may experience problematic gaming behaviors. So the reality is that addiction isn't limited to illegal drugs alone. By dispelling the myth that only illegal drugs are addictive, you open your eyes to the wider scope of addiction. Myth number 3: addicts can quit at any time if they want to. So if this was true, I wouldn't be a substance abuse counselor. There wouldn't be any substance abuse disorder for me to treat. Overcoming addiction would be as simple as flipping a switch. So imagine for a minute that someone told you, "Hey, just stop eating your favorite food forever, starting right now." Sounds pretty tough, doesn't it? Well, that's similar to the struggle that someone with addiction face. Overcoming addiction is not as simple as flipping a switch or summoning superhuman willpower. Fact: addiction is a powerful force that affects the brain and rewires its reward system. It's like an internal battle between the desire to quit and the cravings and withdrawal symptoms that push someone to continue using. Fortunately, we have come a long way in understanding addiction. We now know that it often requires a comprehensive approach involving professional help, support, and treatment. Successful recovery often involves a combination of therapies, counseling, support groups, and in some cases, medication-assisted treatment. Myth number 4. Relapse means failure. This is a great example of something we learn in school called cognitive distortions. Basically, what this means is that you think in the extremes, or you look at things as all or nothing. The belief that relapse is failure can create unnecessary pressure to be successful in recovery and to do things perfectly every time. What is important to understand is that addiction is unpredictable. The challenges you may face in recovery change from day to day or even hour to hour. Recovery is a lifelong journey that requires you to learn, adapt, change, and respond effectively. Imagine you're learning to ride a bicycle. You may wobble, lose your balance, and even fall a few times before you master the skill. But does falling off the bike mean you failed? Absolutely not. It is a natural part of the learning process, an opportunity to adjust and improve your technique. Fact: in the journey of recovery from addiction, relapse is a common occurrence. It doesn't mean that treatment has failed or that you have failed. It's important to recognize that addiction is a complex and challenging condition. Recovery is a process, and setbacks can happen along the way. A study published in the Journal of American Medical Association found that the relapse rate for substance use disorders within the first year after treatment is about 40% to 60%. So it's important to reframe your understanding of relapse. Instead of looking at it as a setback, you can see it as a chance for reflection, self-evaluation, and making necessary changes. It's important to remember that many people who have successfully achieved long-term recovery have experienced relapse at some point. I always remind my clients, a relapse is a learning opportunity, not a reason to feel defeated. Myth number 5. Tough love and punishment are effective ways to help someone with addiction. Imagine you have a friend who's struggling with addiction. You might think that being tough on them or punishing them will somehow snap them out of it. Seems like a reasonable approach, right? Well, the truth is it's not as effective as you might think. Fact: addiction is not a matter of choice or moral failure. It's a health issue and a complex condition that requires understanding and empathy. Using punishment and tough measures to address addiction can actually make things worse instead of better. Punitive approaches can push people away, make them feel even more ashamed, and make it harder for them to ask for help. It's like pouring salt on a wound. It just makes things more painful and discourages them from seeking the support they need. As someone who works closely with individuals struggling with substance abuse, I have witnessed firsthand the profound effects addiction has on individuals, families, and communities. It's disheartening to see how myths and misconceptions misguide people, preventing them from seeking the help they need. It's important to remember that addiction is not an incurable disease. With the right kind of treatment, empathy, understanding, and dedication, it's possible to overcome addiction and lead a fulfilling life. So we must challenge the falsehoods that perpetuate the belief in the hopelessness of addiction. So what are your thoughts? Do you know any other myths and misconceptions about addiction that we didn't cover in this video? Share them with us in the comment section. If you found this week's video helpful and you think someone else might benefit from this information, please share this video and don't forget to watch our other video, 11 Signs of Addiction, to learn more about the signs and symptoms of addiction. Don't forget to hit the like button before you go and subscribe to the channel for more exciting content. As always, spread loving kindness to all beings around you and be the change you want to see in the world. See you in the next video.